If you're on testosterone replacement therapy or thinking about starting it, and you ever want biological children, you need to watch this video before you take another injection. Because there is a side effect of TRT that is almost never disclosed upfront by the companies selling it to you online. It's not in the small print. It's not on the homepage. And millions of men are finding out about it only after it's already happened. That side effect is this. Testosterone replacement therapy can shut down sperm production completely within weeks of starting. Not reduced, not lowered, zero. As in, you ejaculate semen with no sperm in it at all. And here's the part that really matters. When you stop TRT to try and reverse it, recovery is not guaranteed. It can take months, sometimes years. And for some men, it never fully comes back. I'm going to explain exactly why this happens, who's most at risk, what signs to look for, what your options are, and what you can do right now, whether you're already on TRT or just considering it. This isn't scare content. This is information you were supposed to be given before you started. Let's get into it. Testosterone replacement therapy has exploded in the last 10 years, and a huge part of that explosion has been driven by direct-to-consumer telehealth companies. The kind where you fill in a form online, answer a few questions about feeling tired or low libido, and have testosterone shipped to your door within days. Some of these companies are legitimate and operate with proper medical oversight, but many of them are not. And the business model matters here, because companies that exist primarily to sell you a monthly testosterone subscription have a financial incentive to get you on the product and keep you on it. They do not have a financial incentive to spend 5 minutes telling you about the ways that product might complicate your plans to have children. The result is that hundreds of thousands of men, probably more, are currently on TRT with no understanding of what it is doing to their semen. And the men most affected by this are men in their 30s and early 40s. Men who may have already had kids, may have finished their family, or may have assumed they'd figure that part out later. Later arrived, and their sperm count is 0. To understand what TRT does to your fertility, you need to understand how your body produces testosterone naturally, and how sperm production is connected to that same system. Your brain contains a small gland called the hypothalamus. It produces a hormone called GnRH, gonadotropin-releasing hormone. That hormone signals your pituitary gland, also in the brain, to release 2 more hormones, LH and FSH. Luteinizing hormone and follicle-stimulating hormone. LH travels through the bloodstream to the testes and tells them to produce testosterone. FSH travels to the testes and tells them to produce sperm. This is called the hypothalamic pituitary gonadal axis, the HPG axis. It's a feedback loop. When testosterone levels are high, the hypothalamus detects that and turns down the signal. When testosterone is low, it turns the signal back up. Now here's what happens when you introduce external testosterone through TRT. Your brain detects high levels of testosterone in the bloodstream. It concludes that the testes are doing their job, so it stops sending the signal. GnRH drops, LH drops, FSH drops. With no FSH signal reaching the testes, sperm production stops. Not slows down, stops. The testes also frequently shrink in size, a process called testicular atrophy, because they are no longer being stimulated. They are essentially switched off. This is not a rare side effect. This is not something that happens to unlucky men with pre-existing conditions. This is the expected, normal, physiological response to exogenous testosterone. It happens to the majority of men on TRT. Studies consistently show that men on testosterone therapy have dramatically reduced sperm counts, with a significant proportion reaching Azoospermia. That is the clinical term for 0 sperm in the ejaculate. What is Azoospermia? Azoospermia means there are 0 sperm present in your ejaculate. Your semen is produced normally, but when analyzed under a microscope, no sperm are found at all. Not low sperm, not some sperm. No sperm. 0. Nothing. And the timeline can be fast. Some studies show significant suppression beginning within 6 weeks of starting therapy. Others show measurable decline even earlier. If you've been on TRT for 6 months, a year, 2 years, and no one told you this was happening, Your sperm count may currently be 0, and you may have had no idea. Let's talk specifically about online testosterone clinics, because this is where the informed consent problem is worst. A traditional GP or urologist who puts you on TRT is required to take a proper medical history. They should be asking whether you have children, whether you want children, whether fertility preservation matters to you. They should be discussing sperm banking. They should be explaining the HPG axis suppression. Some do this poorly, but the clinical framework at least creates the opportunity for that conversation. With many direct-to-consumer telehealth services, the intake process is a questionnaire. There may be a brief video call. The focus is on symptoms: fatigue, low libido, brain fog, poor gym performance. The onboarding process is optimized for conversion, not comprehensive clinical assessment. Fertility impact is often not discussed at all. Some services do not even ask whether you want biological children in the future. And the men using these services tend to be younger, often in their 30s, which means the stakes around fertility are frequently very high. A study published in the journal Fertility and Sterility found that men who obtained testosterone through direct-to-consumer services were significantly less likely to have received counseling about the fertility implications compared with men who received it through a specialist. That gap in information is causing real harm. And here is something that makes this even worse. TRT does not make you infertile in a way that is immediately obvious. You still ejaculate. You still have semen. It looks the same. It feels the same. The only way to know that there are no sperm in it is to do a semen analysis. Most men on TRT have never done one. Many have no idea they should. Let me be direct about who needs to be paying attention here. If you are currently on TRT and you are not done having children, you are at risk. That's the most important group and the most common one presenting to fertility clinics right now. If you are considering TRT and you might want biological children in the next 5 years, you need to factor this into your decision before you start. If you went on TRT a year or two ago and you've now started trying to conceive with a partner and nothing is happening, there is a very real chance TRT is why. The research on recovery after stopping TRT gives a wide range. Some men recover sperm production within 3 to 6 months of stopping. Others take 12 to 24 months. A subset of men, particularly those who were on high doses for a long time or who had marginal sperm parameters before starting, may not fully recover at all. Age also plays a role. Testicular function naturally declines with age. A 32-year-old stopping TRT is working with a more responsive system than a 48-year-old stopping TRT. Recovery is more likely and typically faster in younger men, but it is still not guaranteed for anyone. There's another group worth mentioning: men who were placed on TRT for hypogonadism, genuinely low testosterone due to a medical condition, rather than the subclinical or lifestyle-related low T that many online clinics are treating. Men with primary hypogonadism, where the testes themselves are the problem, were often already producing poor quality semen before TRT. For these men, TRT may make an already difficult situation significantly worse in terms of fertility. Quick pause. Before we continue, here's something worth knowing. If you've been feeling frustrated or even embarrassed about changes in bedroom performance, sensitivity, stamina, or desire, you're not alone. And it's not your fault. There's a 100% natural solution that's already helped thousands of men feel confident and energized again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. Find out more. There's a link in the description and in the pinned comment. Check it out. It could be the very thing you've been looking for. Okay, let's get back to today's topic. Okay, you've heard the problem. Now let's talk about what you can actually do. This section is practical. I'll go through it clearly. Step 1. Get a semen analysis. If you are currently on TRT, get your semen analyzed. This is a simple, inexpensive test. You produce a sample, it goes to a lab, and within a few days, you'll have data on your sperm count, motility, and morphology. Many high street clinics offer this privately without a GP referral. Some fertility clinics offer walk-in semen analysis. If you are azoospermic, if the result comes back with 0 sperm, you now have important information. You haven't lost time. You've found out now, not when you're actually trying to conceive and wondering what's wrong. Step 2, have an honest conversation with a urologist or a reproductive endocrinologist. Not a GP, not your online TRT clinic, a specialist. Specifically, someone who deals with male fertility and reproductive hormones. Explain that you are on TRT, explain that you want to preserve or restore fertility, and ask about your options. Step 3. Understand that coming off TRT is not always the only answer. There are protocols designed to maintain or restore sperm production while a man continues testosterone therapy. The 2 most commonly used are human chorionic gonadotropin, HCG, and selective estrogen receptor modulators like clomiphene. HCG mimics LH. It directly stimulates the testes to produce testosterone internally, which keeps the internal testosterone environment of the testes high enough to support sperm production, even while you're taking external testosterone. This is sometimes called a co-administration protocol, and it's commonly used in fertility preservation for men on TRT. Clomiphene, brand name Clomid, works at the brain level. It blocks estrogen receptors in the hypothalamus, which tricks the brain into thinking testosterone is low, which increases GnRH, which increases LH and FSH, which stimulates both testosterone production and sperm production. It is sometimes used to help restore the HPG axis in men coming off TRT. Neither of these approaches is something you should self-prescribe or order from an unregulated source. These are clinical interventions that need proper monitoring. The point is that options exist, and you should know they exist so you can advocate for yourself with a specialist. Step 4. Consider sperm banking if you haven't already. If you are thinking about starting TRT and you want to preserve your fertility options, banking sperm before you start is the most straightforward insurance policy available to you. It is not expensive. It is not complicated. You produce a sample, it gets frozen and stored, and it's there if you need it later via IVF or IUI. If you are already on TRT and already azoospermic, you cannot bank right now because there is nothing to bank. But if you come off TRT and recover some sperm production, even temporarily, banking at that point is worth doing. If your azoospermia persists despite stopping TRT and attempting HPG axis recovery, a urologist can discuss surgical sperm retrieval, procedures like TZ, where sperm is extracted directly from testicular tissue. This is a more invasive and expensive route, but it has helped men conceive who were told they had no options. This is a real dilemma, and I want to address it directly because it's the situation a lot of men are actually in. Genuinely low testosterone, true hypogonadism, is a medical condition that affects quality of life significantly. Fatigue, depression, loss of muscle mass, sexual dysfunction, cognitive impairment, these are real symptoms that TRT treats effectively. For men who legitimately need it, TRT is not optional in any meaningful sense. So what do you do if you need testosterone and you want children? The answer is not to simply avoid TRT and suffer. The answer is to work with a specialist who understands both sides of this, who can help you manage your testosterone levels using a protocol that also preserves your fertility, or at minimum, gives you a structured, realistic plan for when and how you might temporarily come off TRT to conceive. Some men cycle off TRT specifically to conceive, using HCG and clomiphene to restart sperm production, then return to TRT after their partner is pregnant. This is a recognized approach. It takes planning and monitoring. It's not guaranteed, but it has worked for many men. The key message here is that you do not have to choose blindly between your health and your fertility, but you do have to have the right conversation with the right doctor. That conversation will not happen spontaneously at most online testosterone clinics. You have to seek it out. I want to zoom out here and connect this to something broader. Male fertility is declining. Sperm counts globally have dropped by more than 50% over the last 50 years, according to major meta-analyses. Men over 40 are starting families later than previous generations. Second families are common. Relationships change. Life happens. And at the same time, Testosterone therapy has never been more accessible, more normalized, or more aggressively marketed. The two trends are converging in a way that is creating a fertility crisis that is quiet, private, and largely invisible because men don't talk about it and because the industry selling the testosterone has no incentive to surface it. What I want you to take away from this video is not that TRT is bad. It's not. For men who need it, with proper management, it can be genuinely life-changing. What I want you to take away is that you have a right to full information before you start. That includes the fertility impact. And if you were not given that information, if you started TRT through an online clinic without any discussion of what it would do to your sperm, then you have some catching up to do, and this video is the start of that. Let me bring it all together and recap all that we've talked about today. Testosterone replacement therapy suppresses the HPG axis, the hormonal signaling chain between your brain and your testes. When that signal is suppressed, sperm production stops. This happens in the majority of men on TRT. It can begin within weeks. It may be partially or fully reversible after stopping, but recovery is not guaranteed and can take years. Direct-to-consumer testosterone clinics frequently do not disclose this. Men are starting therapy without understanding the implications. Many are discovering the impact only when they try to conceive and find their semen contains no sperm. If you are on TRT, get a semen analysis. See a reproductive specialist, not just your prescribing clinic. Ask about HCG co-administration or fertility-sparing protocols. Bank sperm if you can, or before you start if you haven't yet. Know that options exist. If you are considering TRT, make sure fertility is part of the conversation before you start, not an afterthought after. Your reproductive health is not a footnote. It is not a small print issue. It is one of the most significant effects of this therapy, and it's one you deserve to understand completely before making a decision. I've linked some resources below and products I recommend for men looking to support their hormonal and reproductive health naturally alongside any medical treatment they're receiving. Check the description for those and the pinned comment. If you found this useful, and I hope you did, share it with someone who needs to hear it. Leave a comment below if you've been through this. Your experience might be exactly what another man needs to see to take action. Now watch the video on screen in which I reveal 3 ordinary everyday foods that produce lots of sperm in men. You'll be shocked, but pleasantly shocked.